My presentation title was Driving Change to Put the Brakes on Myopia. And I was fortunate enough to be here 6 years ago, and of course the pace of myopia in the UK is changing rapidly, so there's a lot to talk about in just a short space of time.
We know that myopia is insidious in its nature. Children don't know it's happening. Parents don't necessarily recognise it taking hold, and it's often somebody else, perhaps somebody in the education system, that picks it up first.
One of the biggest changes that we've seen is the change in the position from the College of Optometrists, which are now operating under a framework of talking about myopia, rather than being, you don't have to do it if you're not already doing it. So that's been one of the biggest changes that supports the profession, making sure that they're having those conversations with as many children as they need to. Some of the other learnings that we've had have been thrown upon us through the life that we experienced during the pandemic, and the importance of wearing an intervention compliantly. You don't cure a headache by looking at a paracetamol in a box. You have to take the medicine for it to work. And, myopia control is exactly the same.
And we are now really spoilt for choice when it comes to clinically useful interventions available with a strong evidence base that supports their effectiveness. And the first being for the pre-myopes, that's where we start with myopia management. Pre-myopes need to get outside. It's fairly straightforward advice, and I think parents would actually quite enjoy hearing that coming from an authority figure to tell their kids to get off their devices. So perhaps that's a useful approach to start with.
This is a really powerful moment for optometrists who have perhaps grown up in an educational system that is all about correcting and then moving away from correcting into now managing this particular condition. It's a really exciting time to be in the driving seat for that. Optometrists have a really important role in being able to share and raise the awareness amongst the families that they see in their practices, providing better vision for children both now but also in their future.
Waiting is the enemy of success. If we want to really make a difference and stop children progressing beyond and into higher levels of myopia, we've got to get them started sooner and aggressively and get them into treatment as soon as possible.
We know that the evidence base is there. This isn't a fad. It's not a transient moment in time. We're seeing that being reflected by the amount and the volume of peer-reviewed publications that we're seeing each year incrementally. We're going from 120 papers in 2020 right the way through to over 300 in 2022. So the evidence base is there, and if you don't do it soon, you'll probably feel a little bit overwhelmed and a bit left behind. So there are some really useful resources to help get you started, and even if that means just opening up a conversation and referring to somebody with more experience, then that's absolutely what you should be doing.
We need to see these children and manage the problem upstream. I'm sure that the adage of prevention is better than the cure is definitely applicable in this situation here. So if we can move the onset of myopia, delay that onset by a year or two, that's going to have a massive impact, because if Maddie was 9 or 10 when she became myopic, then her journey with myopia would have been shorter and her level of adult myopia would have perhaps been less.